Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurbich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. This podcast is for informational and educational purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your medical plan.
Okay, welcome back to the Point of Medicine podcast. We're really excited to have Dr. Andre Williams here with us today. And I met Dr. Williams probably more than 10 years ago at this point at Schallenberger training. And then I saw him at another ozone conference and I was like, oh my God, what happened to you? I haven't seen you in 10 years. So it was really great to run into you. And thank you so much for joining us. I'm so excited to hear about what you're doing in the injection field, and especially because you're an oncologist. So you're really treating a lot of, obviously really complicated patients. Okay, so I'm going to just, I can't say I know your whole bio, but I'm just going to Dr. Williams is a medical doctor trained in oncology who now practices integrative holistic cancer care. And he has a strong emphasis on using neural therapy in his cancer care and also working with the autonomic nervous system and trying to help regulate that. He combines conventional medical insight with biologically grounded therapies to address interference fields and chronic inflammation and dysregulation at the root. Or the core. Yeah. Through his clinical work and teaching, Dr. Williams is known for translating neural therapy into practical, ethical, patient-centered care, especially for complex cancer patients. And he also has a podcast, which we'll get more info about that later. And he's also just launched a course called the 15-Minute Cancer Decision about helping patients. So we're going to ask him more about that too. So anyway, yay.
Thank you so much for joining us. You are our
It's a
first
pleasure.
oncologist.
Yeah.
Oh, nice. I should get a medal.
I don't, are there many oncologists doing neural therapy? I think
Are there? Do you know?
So I don't know if there are any oncologists doing anything that I'm doing at this point. It's like people ask me what I do and I'm like, how much time do you have? Because it's kind of like I'm a Swiss Army knife right now. Like, it depends on what you need.
So how did you get into medicine?
Yeah.
And then how did you get into holistic or alternative medicine?
So the first question is easier. I got into medicine because I had no choice as a bright kid. And I say that with humility, but it's a fact. I really was a bright kid. So in my country of Jamaica, it's possible to get into university directly, into medical school directly from high school.
Wow.
You have to get really good grades, of course.
My niece is doing this in the UK right now.
There we go. So you understand that it is a little bit different. So I managed to do that at age, 17. And then by the time I actually started university, 18, as the second youngest in my class. I thought I would be the youngest, but I wasn't. And my parents basically had already told me that I'm going to be a doctor. So I don't know if they're going to watch this, but I'd actually secretly applied for computer science and I'd also applied to music school. And so initially I was like, okay, hopefully I don't get into med school because then I'll be able to get into one of those other choices. But, I got in and of course I enjoyed it. And the deal was, okay, you can do those other things once you graduate from medical school. And then when I graduated from medical school, they said, well, you can go do those other things when you've finished your internship. And then, of course, when I finished my internship, they're like, why not just do postgrad? And I was like, all right, fine, no big deal. And postgrad turned into being an attending physician. And by that time, it was like, why not just stick with it? So that's kind of how I got into medical school and ultimately into hematology/oncology, which is where I'm at right now, which is where I was as of 2012. And then I changed hospitals completely. I went from one end of my island to the other one. And as a result of that, I went into what was predominantly a rural population rather than a metropolitan kind of setup. And so here I am thinking that I'm going to make a change in this section of the island, bringing all the latest international guidelines for cancer treatment to these patients. And I'm going to be like, I could picture them lifting me on their shoulders and cheering like, oh my God, you brought us the real deal. Of course, that was never going to happen because for every 20 patients I saw, maybe 4 or 5 of them actually wanted to accept chemotherapy or radiation. And then ultimately, we know what the stats are like for those who actually do anyway. So maybe one or two of them at the best would have anything resembling a good outcome. I really got frustrated, and the ideal thing to do at that time would have been to kind of stick with it because I was the youngest oncologist in the country, and of course, it was a bimodal curve. So there's like me at the end, and then at the other end, there are people close to retirement. So I get to inherit the kingdom, kind of. So the best thing to do would have been to just stick with it. But at around that time, I found out about the Gerson therapy. And I thought, wow, what do you say, Ilana?
Can you define it? Can you tell our listeners what it is?
Yeah, so the Gerson therapy is a maybe 100, maybe a little bit more year-old therapy using aggressive nutrition and supplementation to help people heal from cancer and other chronic degenerative diseases. And I literally did not know that any of this was even possible. Like, you'd go to the occasional conference, like they'd fly us up from third world countries up to the international cancer conferences, and you'd have like a kind of side lecture on maybe like protein intake and calorie intake during chemotherapy. But there was nothing to the extent that the Gerson had defined where you could actually use aggressive nutrition to treat the cancer and to help the patient regain not just a quality of life, but ultimately good survival outcomes. So that kind of gave me the first peek in behind the curtain to say, hey, wait a sec. All these myths that we've been told that alternative treatments are not proven and they don't work and they're just, made up. That's not true. There's lots of stuff out there. So from the Gerson therapy, ironically, I started to implement some of what I learned in my first foray into the Gersons. I went to San Diego for a week and trained with them. Came back to Jamaica and started to do a couple of the things like coffee enemas and juicing in my patients. And of course, they started to do a lot better than they did before. So I actually, around that time, won an award from the American Society of Clinical Oncology, which is like the biggest deal in North America for cancer care. And it was for my work that I was doing in a third world country. And so here, all the stars are aligned, right? So I have this kind of nutritional thing that I'm just kind of peeking into. I've won this prestigious award from the governing body of my field, but I'm totally like disillusioned and not interested in doing this for the rest of my life. So I did what any well-thinking person would do who had no backup plan, and that was to completely quit my job and walk away from the hospital with no golden parachute and probably about 500 US equivalent in my bank account total. And I kind of just said, my wife stuck with me. My wife is a nurse and the co-director of my clinic. And at the time, there was no clinic. It was just a few patients that I had, private patients, and we said, well, what are we going to do? And I said, well, we're going to do some Gerson and hope for the best. And one by one, the patients started coming in, and I went from Gerson to learning ozone therapy. And from ozone therapy, someone like Anne was there at that conference in Nevada. And while I was there, somebody mentioned, hey, have you ever heard of Dr. Klinghardt? And I'm like, no. And then the next day, somebody else asked me the same question. And I was like, no. And then the third day, somebody else asked me the same thing. I said, all right, who is this guy? So, so ultimately, I flew to learn neurotherapy from Dr. Klinghardt. And I also decided, since I'm going to fly all the way there, I might as well learn autonomic response testing. And I know I've gone way past the question you asked me, but I'm still going.
You're on our next question, so you're right on track.
Yeah, so I learned this thing called autonomic response testing. Of course, I thought it was witchcraft, but I figured, hey, might as well learn it because it costs an arm and a leg to get to Seattle from Jamaica. So I stuck around, learned it, and came back to Jamaica feeling totally deflated because, of course, there's no one around that even remotely knows what I'm talking about. And I decided, shoot, I just spent close to 7,000 US all told to get this thing learned. And I feel like I don't know what I'm doing, but I'm going to try it on my patients for as long as I can and see what I can make of it. And to be honest with you, and 3 months in, still felt like a total failure. 6 months in, I was like, I'm getting nowhere. But somewhere around 7, 8 months, I started to realize, hey, wait a sec. I'm starting to get reliable results here. Like the patients are confirming that, yeah, that's actually where I feel the pain. Or, yeah, I do have a scar there. Or after you injected that tooth, I started to feel my whole body felt better. So fast forward to 2025, where I just saw Anne. And now I have 8 years of experience doing this injection technique called neurotherapy, as well as autonomic response testing to find out where I should be injecting to begin with. And I'm integrating that not just into cancer patients, but ironically, relatives of my cancer patients have now started saying, hey, you did something for my mom. She's still alive. She's doing well. I have this problem. Could you help me? And so it's been like a really, really unpredictable journey, I think is the best way of describing it, but really a serendipitous one. And I'm really grateful.
So, are you still doing anything with conventional oncology? Are you co-treating while patients are getting conventional oncology? Are you ever prescribing chemotherapeutic agents, or are you really now 100% in a different space?
That's a great question. And I'm not just saying that. It's actually what cuts to the core of what I had to do. So when I got back from Klinghardt, I had to make a tough decision because I'd quit the hospital, but now I have all these patients coming to see me. And in their mind, I'm an oncologist. But in some of their minds, I'm like this herbalist slash bush doctor slash whatever you want to call it.
Naturopath. You're looking for
So
the word naturopath.
naturopath, yeah, there you go. So I decided that ethically it wasn't right for me to kind of be straddling the fence. So what I did was I actually wrote a letter to all of my oncology colleagues here. There are just about 14 of us total for a
In the
population
whole
of
country.
yeah, for a population of 3 million people. So
Wow.
I wrote a letter to the other 13 and I said, hey, you know what? I have changed paths, as you guys have probably guessed. And I think from now on, to be responsible, I think the best thing to do would be for me to stop giving chemotherapy and to have patients who need chemotherapy. And if I agree that they do need it, I'd forward them on to you guys to retain some amount of objectivity and fairness. And in the meantime, I'd only want to see patients who don't want chemotherapy, who are unable to get it for whatever reason, or who have tried it and it hasn't worked. So that was kind of like a crossroads for me where I had to choose how to define myself, which I'm still trying to do. But at that moment, I realized, okay, you're fully committed now. You're not giving chemotherapy anymore. And I really believe that there's still a place for chemotherapy, but I think we've relied on it too much as the treatment. And we've only kind of made it worse by going into immunotherapy and all of these things. But again, I'm probably jumping ahead of your question. Yeah.
Okay. So
Long
my
pause.
I want to know is what did your colleagues think about this? Like, were they like, okay, good, or okay, this guy's a little weird, or what? Are they with you, sending you people to?
So let's start with the letter I sent out. I sent it to 13 people and I got 2 responses.
Okay.
And so that kind of gives you an idea of what they thought, or maybe they didn't get them up. It was an email, so I'm pretty sure they got them. So the first 5 years were really rough because I was pretty much, like I said, on my own, kind of finding my way away from conventional treatment and towards this new thing that I'm still learning. And I really don't have like a team around me. It's kind of like, okay, what do I do here? The truth is, though, that over that 5-year period, those 2 doctors who replied to me have been the most faithful in sending me patients. And so they were kind of like my objective lifeline in the sense that I could treat the patients and then have the patients go back to see them for confirmation that the patients had indeed gotten better. And thankfully, many of them did get better. So when I sent them back to their doctors, they're like, oh my God, what did you do? And I said, it's a very long story. Yeah, but it was really rough. But as it stands right now, though, and you guys may have noticed this as well, I think generally speaking, we're at a very precipitous time in cancer care. I think people are actually, both doctors and patients are finally starting to realize that the stuff that we've been relying on doesn't really work as well as we thought it would. And in my assessment of what's happening, certainly over the past 3 years, I think there's an element of apathy and resignation on the part of the oncologist generally, because you've learned all these algorithms and it really takes a lot to learn them to know where the patient should go in the workflow. And then you're realizing that the patient in front of you never really matches that workflow well. And so you have a choice at that point. Do you continue to just doggedly adhere to this diagram that you have to study, or do you face the patient in front of you and try to let their life wrap around what you're supposed to do? And I think having come out of that, what I call the dark side, it really takes a lot of courage and determination to step outside of the box, because the box is your comfort, the box is your safe zone. And so what I'm finding happening more often than not is patients are disillusioned, but also their doctors are disillusioned. And so there's this just widespread inertia, I think, that's happening in cancer care. And I'm trying my best to be a lot more bold and vocal about how I feel we can overcome this inertia. because I feel like it's what's needed at this point. And I officially forgot what you asked me.
So, question. You gotta look behind the curtain.
Yep.
You saw Gerson therapy,
Yep.
right?
Yep.
And then you went and you learned neural therapy-ish,
Yep.
because that Clin Heart training, I think the
Yeah,
way he does it is he demonstrates it, but he doesn't, it's not
precisely.
like when Ann and I do training, we're doing hands-on.
Yep.
He doesn't do that. Like, he
Well,
demonstrates it.
funny
It
story,
looks
and I'll
like
make it quick. So I had a real hands-on experience because I volunteered
Uh-huh.
thinking that I was going to get to do it on a patient. And it just so happened that he used me
You were
as
the
a
patient,
patient
yeah.
for a crown of thorns, no less. So in
Oh,
a
you're the
way I did, yeah. So in a way I did get the full immersion. And then when he coupled it with the ART, it meant that, for example, I also volunteered to be tested with ART, and ultimately they found a few things wrong, primarily with my tonsils, which was ironic because I'd had them taken out. So I kind of learned quite a bit more than I ought to have, considering. But yeah, it really was a crash course. Unlike you both, I didn't really have a fallback mechanism when I got back home. So I kind of had to read books and figure things out and watch a ton of videos of Clean Heart doing it for other people. So yeah, you're right. It was tough.
And then my other question is, like, one of the things that is, like, I think makes mine and Anne's training so comfortable is we are taught the pharmacology, but we are
Yeah.
taught the herbal medicine. We are
Yeah.
taught the nutrition. We are taught the
Yep.
mineral pathways.
Yep.
You had none of that.
Mm-mm.
So what
Yeah.
were you mainly just using neural therapy and ART initially?
So
well, there too. That's a lot of nutritional stuff, right?
yeah. So I was doing a lot more nutrition initially. I was also, at some point, I kind of overheard about Gonzalez around about the time when all of this was
Does he
happening.
do enzymes for pancreatic
Yeah, so
cancer? Is that
lots
him?
of
Yeah.
enzymes and aggressive supplementation. And so I was kind of tweaking, the little tidbits that I could find about what that was like. I was kind of tossing that in and kind of seeing what worked and what didn't work. I found, for example, that telling patients in my local population to change their diet to this rigid vegetarian diet and enzymes and all this stuff. Initially, they're like, yeah, let's go. And then, like, after 3 or 4 weeks, they're like, no, let's stop. It's like, I can't eat the same thing every day for one day longer. So I quickly realized that as powerful and accurate as the Gerson therapy and other nutritional protocols are, patient compliance really becomes an issue. And then, of course, I was still kind of experimenting with doing neural therapy for cancer patients as well as others. So I think what happened over time is I started to find what worked for me. So I found it funny that I saw Anne the other day at the Frontiers conference, because I was asked to conduct a workshop on neural therapy, and I kind of laughed because I'm like, I really hope Dr. Klinghardt isn't there. And then I saw Anne, and I'm like, oh my god, like I know what I'm teaching is not the purest neural therapy, but yet it's what works. And I mean, like Anne was there, she saw that it worked in real time, with a live
Mhm.
audience. So truth be told, I don't know that I'm practicing neurotherapy as the Huniki brothers, or however you pronounce their name, would have liked to see practiced, but I'm finding a way to help my patients, and that's what I'm grateful for.
So can you tell us how you weave neural therapy, like a patient case or a
Yeah,
patient experience?
yeah,
Yeah.
yeah, yeah. So I'll give you an actual case. So this 82-year-old lady comes to see me, and she says, I have cervical cancer and it's metastatic to my lungs. And I think the doctors had given her a trial of chemotherapy at age 82. And of course, she didn't enjoy it. So she said, Doc, I want to be able to wash my clothes, which she does by hand, and hang them on the line again. That's all I want to be able to do. Like, that's something I was used to being able to do. It's my independence. I want to get that back. So I know classically you're not supposed to use neurotherapy for cancer treatment or in cancer treatment, but when I did the autonomic response testing for this lady, I found that her laparotomy scar from where they had attempted to do some surgical resection abdominally was a major interference field for her. And then she had, if memory serves me right, she had also had her appendix out several decades prior, and that was also an interference field. So I said, well, they're there. I might as well treat them. I mean, it's not like I'm treating the cancer with neurotherapy. So I did that. I, did some scar therapy for her, and for both the appendix scar and the laparotomy scar. And then I said to her, hey, let's try a little ozone. I gave her maybe 3 sessions at most of ozone, major autohemotherapy. And I said, well, of course I did it free. And so I said, well, let's see how you do. Well, suffice it to say, Anne, Ilana, that was 5 or 6 years ago,
Yeah.
right? And I mean, when she does her CT scans, the Mets are still there. I'm pretty sure the mass in the pelvis is still there as well. But she has her independence. She's lived for 5 or 6 years additionally. She's hanging her clothes on the line. She's cooking for her family at age, I guess that would be now 88, 87, 88. See, what do we care if she still has cancer at this point, right? So that's the kind of, I think we've maybe become a little bit too black and white with outcomes for patients. And you see it happening in the conventional world as well, where they're trying to define positive outcomes. Like every single time a new study is published, the way how they define success slightly changes. So at one point it was progression-free survival, then it was disease-free survival, then it was minimal residual disease. They're finding different ways to weave in the fact that we've not quite eradicated the cancer, but the patient is feeling better. And there's no problem with that. It's okay to admit that we haven't gotten rid of every single cancer cell, but we've improved the patient's life and they're still alive. So I'm kind of hoping that at some point there's going to be a complete circle where people start to realize, all right, let's just start over, both on the far extreme herbal side as well as on the far extreme allopathic side. Hey, none of us are getting the greatest of results, because I know you guys are pretty regimented in how you do things, but there are people who will give you the usual story, like all you need to do every day is drink lemon water and the cancer will disappear. And those are what I call the extremists. And they need a wake-up call just as much as the chemotherapy docs do. So, I'm kind of hoping that, we can find a way to accept that none of us have all the answers and to be able to have better dialogue across the table, so to speak.
Yeah. I so appreciate that. And, I know that, so you're treating cancer patients. I know in Europe, in neural therapy, they treat cancer patients, but like when our students are like, can I treat cancer patients here in the US? I'm like,
no.
no, it's such a litigious country that,
Yep.
they're going to blame the procaine before they're
Yep.
going to blame anything else,
Exactly.
if something goes wrong. And it's like so sad, because it's like, this would be such a great therapy, I think, for helping people's symptoms and stuff.
Yeah, of course. Of course.
Can you get procaine in Jamaica?
So it's funny you ask, because the answer is a big fat no. So I have a very rigorous, I hope nobody watches this from like customs, because I have a very rigorous and roundabout way of getting it into my office, which I will not reveal on air.
Great. Good idea. Also,
yeah. Go ahead.
One of our students, a really, really smart doc out of Montana,
Yeah.
he will treat late stage terminal cancer patients with tumor masses. And one of the things he's trying with them is ozonated glycine.
Yeah. So
glycerin.
Yeah.
Ozonated glycerin.
Yeah.
Do you have experience? But can you tell us a case about that?
So it's funny you ask, because I've only just started to integrate that into the whole mix as well. Because technically, to administer the ozonated glycerin, you really ought to give it with a little bit of procaine anyway, right? And so we do the whole circular dragon technique around the mass. So you're getting the benefits of neurotherapy as well as you're getting the benefits of the ozonated glycerin, which is kind of like a slow release time capsule that just releases ozone slowly over the next, they've estimated maybe 90 days in terms of the half-life. So that's pretty helpful stuff. And I'm excited about the initial results I've been getting. I presented briefly on it when I was at that conference with Anne, a lady who came in with a huge hepatic mass, solitary hepatic mass. It was maybe 10 by 20, if memory serves me right. And I treated her with the ozonated glycerin and procaine, of course, just kind of some quaddles around the mass.
So very superficial, like subcutaneous.
Exactly. Because I was like, I don't have ultrasound guidance. I don't know if there's a vessel under here. So I'm just going to go. It was probably like intradermal. That's how cautious I was. And as you could imagine, because I'm telling the story, 2 weeks later, the mass had shrunk to 15 by 7.5, I believe. Yeah. And I didn't even notice it. It was her relative who pointed it out to me, because I was like, there's no way. She's like, Doc, yeah, this thing looks smaller. I'm like, nah, it's just been 2 weeks. And they're like, no, it's smaller. So yeah.
I think, I treat a lot of patients with chronic infectious disease. And I feel like what my thought process around the immune system is, I think that the procaine is helping to bring the immune system to that area that I think has been walled off. Is that your experience, or do you have other thoughts on how it's working?
So there's a really great diagram that Dr. Klinghardt, I don't know if he created it himself, but I'll never forget seeing that diagram, because it was such a pivotal moment for me. Hopefully I'll be able to send it to you. Maybe you could display it. I don't know. But the point is that he showed where the autonomic nervous system, the fibers of the neurons actually extend all the way up to the cell membrane of the parenchymal cells, which means that the fibers are going into the extracellular matrix all the way up, abutting against what we think is an independent cell that's being governed by hormones and iron, sodium, potassium, and chloride and all these things, when in fact, it's easy to argue that the autonomic nervous system is the immune system.
Yeah.
Because, of course, the cells, I think it's the natural killer cells, Dr. Candice Peart from Australia, I think, demonstrated some years ago that they have receptors for acetylcholine, which means that all the cells in our body are gathering instructions from these autonomic fibers one way or another. So this ease really just means that there's a dysregulation of that extracellular matrix, not necessarily even the cells, but the extracellular matrix itself, within which the autonomic nervous fibers need to reside and ultimately terminate. And I think when we give the procaine, we all know what it does to the nervous fibers, but I think it also starts to clear the ECM of all the different stuff that's been interfering with coordination and regulation of the interaction between the parenchymal cell, the nervous system, and the immune system cells in quotation marks, the white blood cells and other supportive cells. So I pretty much believe that, as Anne is probably hinting at, when we treat with neural therapy, because there's no real differentiation between the immune system, the cardiovascular system, gastrointestinal system, once we treat with procaine, we're treating everything. And so that line of delineation doesn't really exist as far as procaine is concerned. And that's why I think we get really good results. I said we.
So I just was recently exposed to a study out of India, which I
Nice.
shared with Anne, where they are using lidocaine pre-surgically before resecting breast cancer masses. Have you seen this?
Wow. I
So
have
it was
not.
it was a big study out of India, and
Wow.
what they found is if you inject lidocaine as a surround the dragon form around the mass, 8 to
Wow.
10 minutes prior to doing the lumpectomy, you have a
Wow.
20 to 24% improvement, longevity. So you outlive
Yep.
control.
Yep. Yep.
I mean,
Yep.
and that's lidocaine, which,
Yep.
in neural therapy and pure neural
Yep.
therapy, we do not use
Yep. Yep.
because of
Absolutely not.
the toxicity
Yeah. The
of it
metabolic.
locally.
Good.
But that was like, so my thought process is it's maybe not just the substrate of procaine, but it
Yeah.
maybe is the immune notification of the needle.
And it clears extracellular matrix. So,
Yeah.
that makes the body better able to drain waste products off, get fresh stuff in, nutrients and oxygen. And, the whole concept of this sodium potassium ATPase pump probably doesn't even exist in the truest sense. I mean, we know how it works, but what's controlling it is not arbitrarily sodium and potassium. It's the same autonomic nervous system that's kind of
Yeah.
dictating what happens. So we should not be surprised. And again, I wanted to frame my answer in, I'm not saying that neurotherapy is a panacea, right? Like, everybody has their kind of tool that they feel this is all we need for the rest of our lives, and nothing else is going to work except this. So I'm in no way deceived, but at the same time, I do appreciate why it's such an effective tool,
I also just think part of my view on it is if you have an understanding that the body is complicated in black and white
Yep.
and you're looking for other tools
Yep.
and you're discovering one of the tools, be it neural therapy or something else,
Yep.
you are
Exactly.
probably more open-minded to other tools like
Exactly.
ozone, like ART, like herbs, and even like using pharmaceuticals
Yep.
in a naturopathic lens.
Precisely. And I think what happened to me was, because I didn't have the benefit of learning all of these tools at the same time, it was kind of like I was exposed to this thing, I carried it back home, and I'm in this kind of vacuum trying to make it work. And whereas perhaps Anne may have immediately been exposed to something else that was just as shiny and looked just as nice. And so it's like the way I think of it is, if all I have is a hammer to hit nails with, I'm not going to try anything else, because only thing I have is a hammer. So eventually I'm going to become the best hammerer of nails there is. Whereas Anne may then go on to find out, hey, actually there's this new technology where you have this pneumatic hammer, which, you just press a button and it, hits the nail right in for you, or like a nail gun, right? So I guess in a way it was good that I was so isolated, because it forced me to just work at this one thing over and over and over. Right. So I'm grateful for that.
How often do you come to the States to take trainings?
Initially, I just say not very often. So when I was on the dark side, of course, I would be sponsored to quite a few conferences, almost twice, maybe 3 times a year. I'd go to some sort of international cancer conference, which was sponsored by a pharmaceutical company, for which I'm grateful. So that I could be exposed to all of what the rest of the world was doing. But since that time, not so much. I guess primarily because I'm no longer doing pharmaceutical stuff heavily. So there's no real advantage to me going to these conferences or being sponsored to go to these conferences, though I was grateful. And so most of the stuff I do is paid out of pocket, which brings economies of scale into the whole discussion. So I haven't been able to do as much. Having said that, I've been grateful to attend 2 of the Frontiers conferences, which is where I met Anne again. The first one was to present some of my stage 4 cancer cases and what I was doing with ozone for them. And the second one is what I did just a month ago, talking about neurotherapy. Yeah.
Okay, we're going to ask you a question we ask everybody.
Okay.
Do you have like a favorite injection that you do that you feel like works really well for a lot of people? I know
I
you do air,
do.
so I know you're going off that mostly,
Yeah.
but
Yeah.
we
Yeah.
all have our favorites, so we got to ask.
Yeah. So when I answer this question, I'm gonna need you guys to teach me, because I actually don't know the stuff behind why I love it this much or why it works this much. But I do this circular dragon technique around the umbilicus.
Oh,
Yeah, which nobody really taught me. I think again, I'm just fooling around. Fooling around doesn't sound good. I'm just innovating.
practicing. You're
I'm practicing
practicing
it.
medicine.
You're practicing,
Practicing.
exactly.
And so Dr. Klinghardt had taught us this semicircle thing just below the navel, kind of like a smiley face, and he called it a smiley face. And I found that something told me that the patients were only getting 50% benefit from that smiley face. So I said, what if I also did another smiley face upside down above the umbilicus? Yeah, all of a sudden I had this thing that people were saying was really causing shifts from head to toe. So they'd feel tingling sensations in their toes. They'd feel their head getting lighter, like it's going to float off. You know, all the lightning reactions that people have. And it wasn't until after I was doing it for quite some time that I thought to myself, you know, Andre, this actually isn't what you were taught. You're doing it wrong, but it's helping these people. And I feel like it really helps them to open up to the rest of the injections that I have to do for that session as well. If of course they need it on ART, I always try to start with that one, because you guys can tell me why it works that well. The umbilicus, I guess, is
The original wound.
there you go.
The original
There you go.
interference field.
There you go. Yeah. So
Well, you know what I like doing, what I realized is like if you start with the abdomen, like we just do like kind of the little like trigger points, like or the
right,
little fascial, like, where you
right.
can kind of feel where
Yeah,
everything's
yeah.
and we'll just do like, half-inch superficial injections. But I notice if I do that first, I think what's happening is it's going right to the enteric nervous system, going
Uh,
right to the vagus nerve and going right up
nice,
to the brain. So I just
nice.
noticed that people get really relaxed from that. So
Exactly.
I agree. I mean, I think that's
Yep,
doing the gut, like
yep.
immediately treats the brain.
Yep.
And I'm an acupuncturist by trade, and then Chinese medicine is very clear. You
Mhm.
never needle the umbilicus. And it
Oh,
wasn't until I studied with David Vinyas, where he was like, the most powerful thing to do is to go right through the center of the umbilicus, because all of the
nice.
fascia and the tissue is very
Nice.
superficial.
Yeah.
And so you can cover every vessel that
Yep.
Anne was just talking about.
Yep.
And that
Yep.
is, for me, I don't do the smiley face or the circle. I just go right down the middle of it.
Exactly.
And I can
Yeah,
put
that
2 to
makes
3
sense.
cc's right there, and it is like a big reset for the
That
digestive
makes
system.
sense. And the kinds of lightning reactions that I get are, the really weird and wonderful ones, right? So Anna was there when when I was there in November, one of the patients started, I think she was just suddenly started vocalizing this hatred that she had for her ex-boyfriend or something. And I just put the mic to her mouth and I'm like, what are you feeling? And she's like, I hate you. I'm like, oh, no. So yeah, but I probably should ask you guys. I'm not the host here, but I'd love to hear some of the lightning reactions you've seen, because I've gotten some really weird ones. I've had people who I kid you not. I was doing some work with a young lady once, and after injecting her, she said that she could hear the conversation that was taking place across the street from my office. And I'm
Hmm.
like, whoa, are you for real? And she's like, yeah, I can tell you. And she told me exactly what the person said. Of course, I couldn't hear it because there's a sheet glass, like a sheet of glass right there. So I'm like, how are you hearing this? And there's like noisy traffic. But she said she could hear it, and I didn't doubt her. I've had people say that the walls change color while I'm doing the injections. It's just been really interesting, and I wouldn't say there was ever a dull moment since I've started doing this thing.
I love yeah, I would agree. Like every patient, it's so different and it's so fascinating. It's just
Yep.
never boring doing neural
Oh yeah.
therapy.
Oh yeah. Oh yeah.
And it is not uncommon for me to trigger like waves of crying. You know, I treat mainly women to
Wow.
trigger waves of crying, like really
Wow.
processing this grief that they've been
Yeah.
holding.
Yeah. Yeah.
And for me, my favorite injection, ironically, because I my practice is very GI oriented, is
Yeah.
the pelvic injection.
Ooh,
And you
nice.
know, women hold so much of that emotion in their pelvic bowl.
Yep. Yep. I
So
agree.
you do. I know
So do men. So do
do.
men. That's
They
true.
just might not admit it.
Agreed. Agreed. Why should we? Yeah, that's all right. Yeah, go ahead.
What?
So oh, go ahead,
No, you
Alana.
go.
I was just gonna ask, like, just kind of looking forward, what do you think is like, because kind of just tagging off of what we're just talking about, what do you find sort of the most inspirational about what you do, and kind of where do you see this going?
Yeah. Yeah. So a thought just kind of flashed before my eyes, which is I don't know if you both have realized this, but we're actually practicing in the 100th year of neurotherapy right now, right? Because
I did not think about
1925.
that.
So I think that's significant. And in terms of where I see it going, well, there are a couple things. Number one, I don't know if you noticed during CO whatever dash D, there are a couple mainstream hospitals that started to do stellate ganglion injections quite a bit,
Hmm.
especially for anosmia when the patients couldn't smell anything and then were public. They got to publish on social media these videos showing how well it works. And I'm like, my videos get taken down for the exact same thing. What's going on right now? Like, I don't get it. But I think even the three of us on this call at some point have become victim to the concept of marketing that we didn't realize was happening ever since we were kids. So for example, advertising analgesics on TV in the middle of your favorite show, take a Panadol, or essentially telling women that their menstrual period is supposed to be painful by advertising a pain relief for your menstrual cycle as if, hey, it's to be expected. And so that level of programming over the years has been really, really effective. Certainly for me, I had to do a lot of unlearning just to get used to the fact that patients could come into my office, sick and leave well, like the same day, and I think it takes a little bit of unlearning on the part of the patients as well, which is, I think, contributing to what Dr. Ilana said just now about the crying. I think the crying is a grief being released, but I think the crying is also a little bit of disbelief when you're grieving about the fact that all this time I was told that there was no way I'd get better, and then suddenly I am better in the space of a few seconds, and it's just too much to comprehend. Where do I see this going? Well, I have determined for my own voice that I'm going to speak as boldly as I can because I need to, because I feel like it's no longer just about overcoming the resistance from other practitioners or other physicians, I should say, but it's also now about speaking up on behalf of the fact that there is a technique for healing or various techniques for healing that do work. Because now what I'm finding is my colleagues themselves are becoming disillusioned, as I mentioned earlier. And so I'm speaking not just to patients now, I'm speaking to my colleagues saying, hey, there's things we can do. And I'm actually having a few colleagues reach out to me now to say, hey, I'd love to come and train with you for a little bit because I'm
Cool.
feeling like I'm going to close my practice down if I don't. Yeah.
Yeah.
So I feel like this is a watershed moment for us where we have to stay vocal, we have to stay open-minded and not judgmental. I feel like there's too much polarization of different concepts and belief systems, and that's not really helping anybody right now. So I feel like if somebody says chemotherapy is the best thing, all right, let's talk about that. Why do you think it is? Why are you open to the possibility that it's not? And similarly, somebody who says it's all lemon water and soursop and
Then
cayenne pepper. You read it. You read my mind. Okay, let's talk about that. And I feel like this is the best time to have some real open dialogue. My videos are getting taken down left, right, and center on social media, but I'm finding ways to say what I need to say. And I think hopefully there will be some sort of a shift, even if it's incremental. It'd be good to be able to have more dialogue like the one that we're having right now.
Yeah. I agree. In the States, like all of my friends who, I mean, I think COVID really kind of was a big,
Yeah,
nail in the side of a lot of providers, and just realizing like they couldn't help anybody with long COVID. They didn't know
there
what
you
was
go.
going on,
There you go.
like, and they were totally burnt out. So, I mean, a lot of my friends who are medical providers are finding other careers or getting
Yeah.
into more functional medicine stuff
Yep.
because,
Yep.
like, this stuff actually works.
Yep.
And I don't think anything
Exactly.
else I'm doing is working. So I
So,
Exactly.
definitely see that in the States too.
Yeah.
are
Yeah.
you still an island? Is there anybody else who does similar things to what you do in Jamaica?
Yes, there is. I think, well, actually, I need to tell you that story. So I have someone I call my big sister who reached out to me at a very critical time when just as I was about to leave the hospital. Like I sensed intuitively that, yeah, I'm not going to do this for much longer. And at that time, here comes this doctor who was ahead of me in medical school, but went on to do what you guys have done. We reconnected and she said, hey, I want to tell you about something. And she started kind of gently mentioning to me that there are other things that are out there. So I had that moment where somebody reached out to me and said, hey, let's talk about this a little bit more. How do you feel? And I'm like, listen, I don't want to see the word chemotherapy, let alone mix anymore with anybody. And she's like, okay, cool. So there's this thing called neurotherapy. And she lent me that big book by Dosh. And like, I'm flipping the pages like, oh my God. But then it wasn't the right time. Yeah, because I was still kind of feeling my way around out of the darkness, kind of seeing what else is out there. So neurotherapy probably wasn't the best thing for me to get introduced to right away because it seemed
Especially
kind
not
of
with those
crazy. Exactly. So it seemed kind of like, nah, this is too much. And then the needle sizes didn't look familiar to me or anything. So it's like, what is this thing? But eventually I circled back around, obviously through training with Klinghardt. And ultimately I have my own copy of that book now and I consult with it quite a bit. I feel like I said before, I feel like we can be that big sister or big brother for someone else. So, her name is Dr. Janice Fisher. I'd encourage you both to interview her at some point as well. And she's been doing stem cells. She's been doing neurotherapy for ages. She's been doing heart rate variability. She's been doing, oh God, what's the name of this drug? I'm going to tell you in a second. L-carnosine. L-carnosine? Yeah,
Yeah,
carnosine.
L-carnitine.
Yeah. Well, L-carnitine, but also carnosine, which is this like Russian technique or something like that. So we kind of bounce ideas off each other, but yeah, it's a lonely ride at the moment. You guys are probably better friends or better support systems for me at the moment than anybody locally.
Is this doctor local? Is she in
Yeah,
Jamaica?
she is. She is. So it's just the two of us. It's just the two of
Okay,
us.
so there's at least one more. Yay.
Yes.
You're not
Yes,
so alone.
exactly.
Good, good.
Exactly. Yeah.
Well, do you wanna tell us a little bit about the class that you just came out with? 'Cause, some of our
Yeah.
listeners might be interested,
Yeah.
or they cancer patients that are interested. Yeah.
Yeah. So, I'm a solutionist, and I say that without apology, sometimes to my own detriment. But in 2024, I had two really, really emotional encounters with patients. The first was a couple in their 70s. The husband had been diagnosed with cancer and they booked to see me because I do a lot of remote consultation. They booked to see me for essentially what was to be and call it a second opinion. And so they were from New York area, upper New York area, upstate, and they said, "Hey, we just went to Memorial Sloan Kettering, and she's been diagnosed with XYZ, and we wanted your opinion in it." So I'm like, "Okay, these guys are gonna ask me some complicated questions about targeted therapy or something or the other, and what it means." And so I said, "Okay, shoot, what's your question?" And they're like, "Doc, what's a biopsy?" And I'm like, "Whoa,
Mm.
hold up." Are you serious? And they're like, yeah, nobody told us what a biopsy was. And then their next question was, what does stage 3 mean? And I'm like, wow, okay. So I said to them, I said, you're asking me for a second opinion, but it seems like you never even got a first opinion. So how did that meeting go? And they said, well, we had done the biopsy and we were called into a meeting and they basically said, you have stage 3 lung cancer and your chemotherapy starts on Monday. Today is Wednesday. Please walk around the corner to the chemotherapy unit, hand in this slip of paper, and make sure you're here Monday at 9 o'clock. That's it. So I thought, well, maybe this is a fluke. And then like 1 week later, the exact same experience, this time with a young lady, doesn't know what a biopsy is, doesn't know what stage she is. And it's like, whoa, how do you expect these people to just, like sheep walking into a slaughterhouse, just not literally, I shouldn't have said that. And they're just going to walk in and just have this thing administered to them without even knowing anything about their disease. And
Hmm.
it hit me really hard. It kind of had me very emotional for a good couple of weeks. And then I thought to myself, why not just create a course to help people to navigate? Like navigational courses have been done over and over about how to navigate chemotherapy, get some good rest and hydration and all that stuff. But more fundamental questions have never been addressed. And so I came up with this concept of the 15-minute cancer decision, which essentially is a way of getting patients to block out all of the noise and emotions and confusion that they feel when this thing comes hurtling at them, and to be able to get an immersion in exactly the survival tools, although I hate the word survival, that they need to prepare themselves to heal. And so the modules go, for example, what is cancer? So we don't take anything for granted. What is cancer? What is a biopsy? All of that stuff. But also, what is the healing mindset? What are good questions to ask my doctor?
Hmm.
How do I communicate with loved ones? How do I choose the right people to communicate with? And how do I have that initial conversation? The do's and don'ts of journeys, for example, not spending all night on the internet Googling your disease because you're going to get a million different
Yep.
opinions and non-facts. And then, of course, it goes all the way up to how to choose a protocol that's likely to work for you and what are the elements of a good cancer treatment protocol. Spoiler alert, they're something that kills cancer cells, but also provides nutritional support, detoxification, and spiritual and emotional support. So all of a sudden, you move away from all this stuff, noise hitting you to, okay, let me find a protocol that has these 4 things. And then you start to learn why one single approach to killing cancer cells will never be enough to heal somebody, because there's so many other things that are required. And ultimately, having gathered all this information, I walk you through the module that's most pivotal, which is put everything together in a little questionnaire. And those questionnaires will be sent to me, at least for now, until I learn to trust AI, to kind of weigh all their answers and say, well, based on what you've said, this is probably going to be the best approach for you, which, by the way, sometimes is doing nothing, because that 82-year-old lady should not have gotten chemotherapy. I don't care what anybody says, right? There's
Yeah.
no way.
Yeah.
So, so my hope is that it will kind of create an opportunity for patients who otherwise would have been sent to, some typical cancer education site that gives you all this stuff that still doesn't make any sense to you, to kind of have something that feels more closer to home, something they can relate to, and ultimately feel empowered to make a confident decision regardless of what their doctor thinks, their nurse thinks, or even their family or friends think. So that's the aim. It's called a 15-minute cancer decision. I made a mistake when I first released it, which is I kind of did like a minimal viable product. I wanted people to kind of give me their feedback and help me to kind of sculpt it into the final product. And then I realized nobody has the time for that. So, so I'm gonna have kind of reworked it. I'm gonna just push the information out there, and if somebody has additional stuff that they'd love to see, then I can always update it with time.
Wonderful. Sounds
Yeah.
like such an amazing tool for
Thank you.
patients.
Thank you. Yeah. Yep.
Okay, so how can everybody find you? How can they find the class?
Yep. Yep.
And just tell us a couple things about your podcast.
Yep.
What do you specialize in
Yeah.
on your podcast? You
Yeah,
inter
so my podcast is, I need to get you guys on, right? So so my podcast is called Healthy Reasonings, and it's essentially just what we're doing here. Like, I feel like that talking about health needs to become a lot more than having somebody like me sitting in a white coat, which I deliberately didn't wear. And we need to have more conversations like these, which are a lot more laid back and where you feel like you can relate to what's being said. So I speak about cancer diagnoses, but I also speak about how to communicate with loved ones, some of the very things I said before. I speak about how to maintain a focus on healing. I just really just speak about the things that I know patients most need to grasp. But then I also bring people like yourselves on quite a bit to get their feel on what works for them with their patients and what their experiences have been in life. And I've found that almost every practitioner that I bring onto the podcast, without knowing it, they say basically the same themes. which is I got into medicine because either it was a family tradition or I was very sick and I wanted to help people. They also say, hey, the body was built to heal itself. And I don't prep anybody, I just chat, right? And all of them say the same thing. So we know we're kindred spirits in that way. We all know what's true, right? So I put an episode out every week, except for the past couple of weeks since I've had no electricity due to the hurricane in my country. I'm up to about 52 episodes, I think. So I'm not doing too badly. So it's over a year and I really enjoy doing it. And in terms of getting in touch with me, I've actually created a community now online as well called the Healthy Reasonings Community, which is kind of like a more approachable Facebook. So people can post their thoughts on various things and comment on the podcast episodes, meet other friends and like-minded people. And so I think the best way to reach out to me is either by commenting on the podcast or joining the community. I do a little bit of Instagram and Facebook, but for obvious reasons, I limit that because everything I say gets kind of
Yeah.
gets censored. Yeah. So, but I do have a Facebook and an IG, which is Wellness Doc Jamaica. So you can find me there for the few times that I jump on.
Wonderful.
Thank you. This was so inspiring to just
Thank you.
obviously clearly hear your passion for what you do. And, you know, I do think you're right in medicine. If you're in the conventional box, it gets more and more difficult to be passionate. And that
Yep.
is,
Yep.
if we are not passionate, it's hard to be of
Yep.
service to our patients.
Exactly. Exactly. Thank you.
All right. Well, thanks again. And I guess it's time to wrap up another of our 12th or 13th or whatever episode of we
Great
just
job.
started a year ago of the Point of Medicine podcast. So thank you.
Great job, guys.